Okay, good evening everyone. So my name's Glen Ward and I've been kindly asked by Mr. Pillai to explain the advantages of Optom co-management in practice. My personal interests go back to when I first qualified back in the early 80s. I used to look through the magazines that came out, the Optician. There were some very interesting types of procedures available in those days, thank you. There was obviously a guy called Harley, as you know, he was innovating and doing a CK on his ship that used to go around Europe, and that went on for quite a few years, and it didn't seem particularly successful. The radial keratotomy it was. There are many complications, and as you know, you get patients that come in and see you and want to talk to you about what they've read in the press, ask you lots of questions, would they be suitable or not, and I think really at that stage there were so many complications it was probably not a good idea to recommend this. We move on into the 90s now, and we've now got LASIK that suddenly appeared. I think that came around about 89, got an FDA approval, I'm getting a dilemma now, as it's getting through to sort of the late 90s, and get my patients again asking me about this new LASIK, and because it's been going on for such a short period, it's very difficult to again recommend them to have this type of procedure. At the end of the day, it's been around probably 5, 6, 7 years. You still don't know whether these people, there's going to be a problem at a later date. But of course the years roll on now, we're now to 2000. It's looking like it's going to be, pretty good surgery. I looked around and there was a company called Advanced VisionCare at the time that were doing majority of surgery in this country. I think they had a place in central London, and they also had a place up in Manchester. And I arranged for a rep to come down and see me, and we had a chat, and the guy said, if you want to come and meet the surgeon, you can come and see what he does. I thought, yeah, great. I've been along to see cataract surgery previously, and it was very interesting. So I went along, and I turned up and I met Mr. Pillai, who I sat and watched him do 3 surgeries. It was very interesting. I think, from what I remember, one of the patients that came in was a lady that was very, very calm when she walked through the door. Mr. Pillai reassured her from top to bottom. She had the surgery, and when it finished, she said, is it finished? And Mr. Pillai says, yep, it's all done. And she just fell apart. I mean, really, the relief that the surgery was over was all too plain to see. It was very touching, actually. Anyway, I arranged to be trained by Mr. Pillai in post-operative care, and that day came when I sent my first patient up to see him, and Mr. Pillai did the operation. I was all prepared to see the guy the next day. And of course, my patient, he decided that he didn't listen to better advice about taking a day or 2 off. He got in the cab, went straight back to work that day. And of course, when I saw him next morning, he said to me that, well, actually, in the cab, he rubbed his eye and the contact lens had come out. I had him on the slit lamp, and I was having a look at this eye, and he had about 5 or 6 folds in his cornea where it slipped sideways, and thinking, this is great, this is where I'm, my very first patient, I'm going to have to send him back to Mr. Pillai straight away. So I sent him back, and this time Mr. Pillai did the first check-up the next day. He actually lifted the cornea, stretched it, repositioned it, and I got to see the patient 1 week later, and to my surprise it was fantastic. It just looked like the other eye. It had all been fixed, everything was good. I can't remember how things progressed. I mean, certainly after 2 or 3 months, he was absolutely fine. His acuities were as good, if not better, than his glasses. My fears of dealing to do post-operative care in this field had really been allayed, really. I mean, I can see that Mr. Pillar was, helped out in the most difficult situations. Moving on to the patients that I've sent to him since then, it's probably like 80 or 90 now in the 7 or 8 years. They've all come back very satisfied with the results. They've been happy with the personalised care. They're not just the Advanced VisionCare and the staff have given, but also myself as well. I mean, I've always made sure for these particular people that I'm first hand, just to reassure them that, if there's any problems at all, they can contact me, and they're in good hands. Anyway, after so 7 years, it's been I suppose they've become their local trusted optician, and things seem to be good. The thing that patients do like, particularly, they like, say, the individual attention as opposed to some other surgeries that tend to operate people on a conveyor belt. When I say that, they probably see 12, 14 patients a day, and as I said, the individual attention is much better at Advanced VisionCare. Also, reassurance from me does help. So what about losing the 80 to 90 patients that I've lost over the 7 years? Well, actually about 50 to 60 of these were my own patients. About 20 to 30 of them were recommendations from them introduced into my practice. So financially, this is, it's worked very well for me. I'm paid very well for my chair time doing this post-operative care. My patients recommend other people to me. And still, these patients, they still come back for their eye tests. Most of them still have children, so you still see their kids, their parents sometimes. And of course, they recommend their frames because, in general, because I'm linked up with Advanced VisionCare and this type of work, I tend to have a slightly higher profile practice because of this. So what are the alternatives? Well, if I wasn't actively involved, I would simply lose these patients and their revenue. And why shouldn't we be paid for doing the research into autorefractive surgery for our patients? We can offer them first-class surgery, and certainly as you can see with what Advanced VisionCare has, it does, it covers every single sphere to do with LASIK surgery and implant ICLs and CLEs. And of course we can give them the aftercare as well. I'd just lastly like to thank all the other speakers who have made this seminar so interesting and imaginative. It's really been fantastic tonight watching some of the videos that have been shown. And of course I'd like to thank Mr. Pillai who's arranged this wonderful evening. Thank you everybody.